Had no idea that their simple nighttime habits were quietly increasing their risk every single night. Tonight, I'm going to show you 5 evening habits that may silently increase your risk of a heart attack while you sleep. More importantly, I'll show you exactly how to replace them with healthier habits, one simple evening at a time. Stay with me because what you're about to learn could be one of the most important things you hear this year. Here's something many people don't realize. Your cardiovascular system doesn't shut down when you fall asleep. It simply changes gears. In a healthy body, nighttime is when your blood pressure naturally drops by about 10 to 20%. Your heart rate slows, your blood vessels relax, and your cardiovascular system finally gets a chance to recover. It's like an overnight maintenance program that has protected your body your entire life. But after the age of 60, this system becomes less reliable. Blood vessels become stiffer. Blood pressure regulation becomes less precise. The hormones that normally protect your heart during sleep begin to weaken, and suddenly, the margin for error becomes much smaller. Think of it this way. During the day, your heart has several backup systems. It can compensate for stress. It can adapt to changing conditions. At night, many of those backup systems slow down. Your body is essentially running on a skeleton crew. That's why the hours between midnight and 6 a.m. carry the highest risk of heart attacks and strokes in older adults. Not during the afternoon, not during the morning rush, but during those quiet hours when everyone else is asleep. Here's the important part. What happens during those dangerous hours is largely determined by what you did before going to bed, the dinner you ate, the medication you took or forgot to take, the temperature of your bedroom, the amount of water you drank. Small decisions that feel completely routine can quietly determine how hard your heart has to work all night long. Let's begin with the habit that surprises my patients the most. Habit number 1. Eating dinner. Too late. Let me ask you something. What time did you eat dinner last night? And what was on your plate? I ask every patient this question. A surprising number of people over 60 tell me they eat around 8, 9, or even 10 p.m. Often it's a large meal, rice, pasta, fried food, or heavy meat, followed by sitting on the couch and then going to bed within an hour or two. I completely understand why it happens. Busy schedules, family routines, habits developed over decades. But from a cardiovascular perspective, this is one of the most underestimated stresses you can place on your heart. Here's why. When you eat a heavy meal, your digestive system suddenly demands a huge increase in blood flow. Your heart must pump harder. Your blood pressure rises. Blood triglyceride levels increase sharply within 2 to 4 hours after eating. Now imagine going to sleep while all of this is happening. Your body expects the evening to be a recovery period. Instead, your heart is working overtime to digest a large meal while simultaneously trying to enter its nighttime repair mode. Those two demands directly compete with one another. For someone over 60, especially with stiff arteries or underlying heart disease, that extra workload can become dangerous. Research consistently shows that eating within 2 to 3 hours of bedtime is associated with higher nighttime blood pressure, increased acid reflux, which can mimic or even trigger cardiac symptoms, a greater risk of cardiovascular events during sleep. Fortunately, the solution is simple. Try to finish your main meal by 6 or 7 p.m. If you become hungry later in the evening, choose something light, such as lean protein, yogurt, or vegetables instead of a heavy, high-fat meal. Does your dinner schedule sound familiar? You'd be surprised how many people recognize themselves in this habit but never realized it could affect their heart. Habit number 2, taking blood pressure medication at the wrong time. This next habit deserves your full attention because it's one of the most preventable causes of nighttime cardiovascular damage. If you're over 60 and you take medication for high blood pressure, and statistically, many people in this age group do, the timing of that medication may matter far more than you've been told. Normally, blood pressure follows a daily rhythm. It rises in the morning, peaks during the afternoon, then gradually falls while you sleep. However, many older adults never experience that healthy nighttime drop. Instead, their blood pressure remains elevated or even rises during the early morning hours. This condition is called nocturnal hypertension, and many people have never even heard of it. Unfortunately, it can be extremely dangerous. While you're asleep, your arteries are more vulnerable. A sudden surge in blood pressure at 3 a.m. places enormous stress on already weakened blood vessels. That surge can rupture unstable plaque inside a coronary artery. It can trigger a blood clot, and it can quickly become a life-threatening heart attack or stroke. If you take your blood pressure medication only in the morning, its effects may begin wearing off during the very hours when your body needs protection the most. If you forget your medication altogether, your heart may be completely unprotected overnight. So what should you do? Don't change your medication schedule on your own. Instead, ask your doctor one very specific question. Would taking my blood pressure medication in the evening be more appropriate for me? That conversation takes only a couple of minutes, but it could potentially save your life. Several clinical studies have shown that, for certain patients, evening dosing may provide better overnight blood pressure control and lower cardiovascular risk. The key point is simple. Never assume that timing doesn't matter. In cardiology, timing can make all the difference. Habit number 3, ignoring sleep apnea. Now I want you to think about someone you know who snores loudly. Maybe it's your spouse, a parent, a friend, or maybe it's you. Most people treat snoring as nothing more than an annoyance. Something to joke about, something your partner complains about. I look at it very differently. To me, loud, persistent snoring is a cardiac warning sign until proven otherwise. Sleep apnea remains one of the most underdiagnosed conditions in adults over 60. Experts estimate that more than 30% of older adults may have some degree of sleep apnea, and many don't even know it. Here's what actually happens. During an apnea episode, breathing stops for 10 seconds. 30 seconds, sometimes even longer. This may happen dozens of times every hour. Each time it happens, oxygen levels fall. Your brain immediately senses danger and releases stress hormones like adrenaline and cortisol. Your blood pressure spikes. Your heart rate suddenly increases. Your heart is repeatedly forced into an emergency response while the rest of your body is supposed to be resting. Now imagine that happening 30, 40, or even 50 times every single night. The damage adds up quickly. Sleep apnea has been linked to a significantly higher risk of heart attack, irregular heart rhythms such as atrial fibrillation, higher blood pressure, faster progression of artery disease. Because all of this happens during sleep, many people remain completely unaware until they experience a serious medical emergency. The warning signs aren't limited to loud snoring. Watch for morning headaches, waking up exhausted despite sleeping all night, frequent nighttime urination, dry mouth when you wake up, episodes of gasping or choking during sleep. If any of these symptoms sound familiar, speak with your doctor about having a sleep study. If you're over 60, snore heavily, and have high blood pressure or heart disease, getting evaluated for sleep apnea should be considered an important part of protecting your heart. The most common treatment is CPAP therapy. While wearing a CPAP machine may not seem glamorous, the benefits are remarkable. Studies have shown that consistent CPAP use can lower blood pressure, reduce abnormal heart rhythms, improve sleep quality, and significantly decrease cardiovascular risk. Take a moment to think about your own sleep. Has anyone ever told you that you stop breathing at night? Do you wake up feeling tired even after what should have been a full night's sleep? Those are questions worth taking seriously. Habit number 4. Going to bed dehydrated. This next habit is driven by something that seems completely logical, and that's exactly why so many people overlook it. Many adults over 60 intentionally stop drinking water after dinner because they want to avoid waking up during the night to use the bathroom. That makes perfect sense. Nobody enjoys interrupted sleep, and getting out of bed at night can increase the risk of falls. But from a cardiovascular standpoint, going to bed even mildly dehydrated may quietly increase your risk. Here's why. When your body doesn't have enough water, your blood becomes thicker and more concentrated. It doesn't flow through your blood vessels as easily. For a young, healthy cardiovascular system, this may not create a major problem, but after 60, especially if your arteries have narrowed over time, it becomes much more significant. Thicker blood moves more slowly through narrowed arteries and is more likely to contribute to clot formation. Now think about what naturally happens while you sleep. Your heart rate slows. Blood circulation becomes slower. Your body remains in the same position for several hours. Combine slower circulation with thicker blood and arteries that may already contain plaque, and you've created conditions that increase the risk of heart attack and stroke during the early morning hours. Fortunately, the solution is simple. Drink 1 normal glass of water, about 8 ounces, 240 milliliters, before going to bed. Not an excessive amount, just enough to keep your body properly hydrated overnight. If you wake up feeling thirsty during the night, keep another glass of water beside your bed. That small habit can help your heart far more than most people realize. You don't have to choose between protecting your sleep and protecting your heart. With the right amount of water, you can often support both. Habit number 5. Sleeping in a room that's too hot or too cold. This final habit surprises nearly every patient I speak with because it seems far too simple to matter. What temperature is your bedroom at night? Most people have never connected bedroom temperature with heart health. They think only about comfort. But your cardiovascular system cares about temperature far more than you might expect. Let's start with a room that's too warm. When your bedroom temperature rises above 22 degrees Celsius, 72 degrees Fahrenheit, your body must work harder to cool itself. Blood vessels widen, heart rate remains slightly elevated, sweating increases fluid loss, and sleep becomes lighter and less restorative. Your heart misses some of the recovery it normally receives during deep sleep. Now consider the opposite. If your bedroom is colder than about 16, 17 degrees Celsius, 61, 63 degrees Fahrenheit, your blood vessels constrict to preserve body heat. Blood pressure rises. The heart must pump against greater resistance. For someone living with high blood pressure or coronary artery disease, that additional nighttime strain can become significant. The ideal bedroom temperature for both sleep quality and heart health is between 18 and 22 degrees Celsius, 65.72 degrees Fahrenheit. Within this range, blood vessels remain relaxed, heart rate stays lower, sleep becomes deeper, the cardiovascular system recovers more efficiently. Sometimes the simplest changes provide meaningful protection. The heart-safe evening routine. Now let's put everything together. Instead of thinking about 5 separate habits, think of them as one simple evening routine. I call it the heart-safe evening routine. It fits into almost anyone's lifestyle without requiring major changes. Between 6 and 7 p.m., eat your main meal. Choose lean protein, vegetables, and moderate portions. Avoid large, heavy dinners close to bedtime. Give your heart 3 to 4 hours to finish digestion before you sleep. Around 7 p.m., drink water. Take your prescribed medications exactly as directed. If you've never discussed the timing of your blood pressure medication with your physician, make that conversation a priority. For some patients, evening dosing may provide better overnight protection. Between 8 and 9 p.m., slow your evening down. Take a gentle walk. Read a book. Listen to calming music. Spend time talking with family. Reduce exposure to bright phone and tablet screens, since blue light suppresses melatonin and makes quality sleep more difficult. Around 9 p.m., prepare your bedroom. Adjust the temperature. Set a glass of water beside your bed. These small tasks take less than 2 minutes but can support your cardiovascular health throughout the night. By 10 p.m., go to bed. And if you snore or have sleep apnea, try sleeping on your side instead of your back. Side sleeping often helps keep the airway open and may reduce apnea episodes while you're waiting for formal evaluation and treatment. Simple routine, real protection. The question isn't whether these habits work. Research strongly suggests they do. The real question is whether you'll begin practicing them tonight. A personal message. I want to speak to you for a moment, not simply as someone sharing health information, but as Dr. Alexandra. Over the years, I've cared for countless patients whose lives changed overnight. I've spoken with worried families in hospital waiting rooms before sunrise. I've met people who went to bed feeling completely normal, never realizing what was happening inside their bodies. Again and again, the contributing factors weren't mysterious. They were ordinary habits: a heavy dinner, missed medication, a bedroom that was too warm, going to bed dehydrated, years of untreated sleep apnea. None of these are rare. They are part of everyday life for millions of people, night after night, year after year, and eventually those small habits can become a medical emergency no one expected. One lesson has stayed with me throughout my career. Many heart problems don't happen because people are careless. They happen because people were never given the right information. Now you have that information. The most important question is not what you'll do next week. It's what you'll do tonight. Now let's review the 5 heart-protecting habits. 1. Finish dinner by 6 or 7 p.m. Allow your heart several hours to recover before sleep. 2. Speak with your doctor about the timing of your blood pressure medication. Never change your medication schedule without professional guidance. 3. Get evaluated if you snore or suspect sleep apnea. Protecting your airway also protects your heart. 4. Drink 1 glass of water before bed. Proper hydration supports healthy circulation throughout the night. 5. Keep your bedroom between 18 and 22 degrees Celsius, 65.72 degrees Fahrenheit. A comfortable sleeping environment helps your heart recover naturally. Before you go, I'd love to hear from you. Which of these 5 habits sounds most familiar? Was it eating dinner too late, skipping water before bed, or perhaps snoring that you've never taken seriously? Share your thoughts in the comments. If you found this video helpful, please consider sharing it with someone you care about, a spouse, a parent, a sibling, or a friend over 60. A simple conversation today could help prevent a serious health problem tomorrow. And if you're interested in practical, evidence-based tips to support your heart and live a healthier life after 60, don't forget to subscribe and turn on notifications so you never miss a new video. Finally, everything I've shared today is based on current cardiovascular research and is intended for educational purposes only. It is not a substitute for personalized medical advice. Before making any changes to your medications, treatment plan, or health routine, please consult your own healthcare provider. Thank you for watching. I'm Dr. Alexandra. Take care of your heart, sleep well, and I'll see you in the next video.